when we first started out this morning, Susan Daniels commented that this train is already starting to leave the station. And I think that's a very important observation because we want to make sure that before it completely leaves the station, we have a good understanding of who the passengers are that are going to be on this train. The K Center takes a user-centered approach to PHR and EHR and EDR systems design. And by that user-centered approach, we mean to understand the users in a lot of depth. Not from the standpoint of building a system necessarily first and then asking users how they feel about it, but actually asking the users first what they're interested in and trying to build something that will meet those needs. One of the theories that we're looking at in terms of user-centered design for PHRs is that there are material differences among the different types of users. This is of concern because at the policy level, policy tends to be set by people who have jobs, who are not disabled, and who are not often suffering from chronic illnesses. And so there may be some gaps in their understanding of what people who are in these different life situations need. And so with the research that we did, what we have tried to do is look at these different needs and see how we would distinguish user needs in these different groups. And the results, at least preliminarily, have been very revealing. One of the things that we found out is that there is a great deal of enthusiasm for PHRs as a concept across the population, and especially among people with disabilities. But the enthusiasm for PHRs crosses all boundaries. Retired people, we interviewed people up into their 90s, and they are just as enthusiastic about the potential for PHR as people who are in their 20s, and some more so. What we found in terms of delivery of that PHR is actually a little bit different than perhaps what is generally conceived of as the sort of overall solution for PHRs. What we found, and this was very striking, is that there's a strong preference for a portable solution to PHR that is not an internet-based or web-based solution, but something that you carry on your person. And this interest and enthusiasm for this type of delivery method is much stronger among people with disabilities and somewhat more so among people with chronic illnesses. And we think that the reason behind that is something that was expressed in some in-depth interviews that we did with people at Access Healthcare. Several people spoke with us about the experience of being a disabled person, being home alone with no personal care attendant or anyone else there, and they're home one minute going about their business, and the next time that they're aware of what's going on around them, they're in an emergency room. They don't know why, they don't know what happened, but they know that they're in the ER, and it's a critical situation. It can be life-threatening. And so what they expressed to us is the need to have some assurance that somehow their medical information will go with them in cases like this. In fact, one of the delivery methods that we proposed to people was an implantable microchip. And we thought, well, that's pretty edgy stuff, and people might not even want to consider that question. But in fact, a number of people with disabilities told us that they would actually prefer that, because then in this situation of waking up in the ER, they would know that their medical information was with them at all times. I think that's the idea of the portable record is the most striking thing that's emerged from our research. But what we've also found is that in terms of privacy and security, there are differences in what people want. People with disabilities want their information available to emergency services providers. They have a very strong preference. Almost 100% of the people that we talk to want to make sure that when they go to the ER doctor has their information. By contrast, people without disabilities, 75% of them wanted that information available, which means there's a very significant minority who don't even want the ER doctor to have their medical information. But people with disabilities express to us consistently that they want that information out there and shared so that they can get the care they need when they need it.